Hello everyone, my name is Dr. Michael Wald and welcome to this presentation that is entitled Low Energy, Its Causes and Natural Solutions. So I've been in the holistic health field for over 33 years, and fatigue and malaise are among the most common problems that I see. And it always strikes me at the lack of education of individuals that have seen multiple practitioners before me and they still don't have a clue about what their fatigue or malaise is caused by. So I'm going to review with you many common causes of fatigue so that you're simply going to be a better healthcare consumer. So you are likely going to see practitioners which don't consider enough potential causes. You tell them that you're fatigued and they say get more sleep or maybe eat more calories or perhaps exercise. That would be very good advice. But there are many other causes of fatigue that we're going to go into right now that I know many patients suffer with for years or even decades, when some of them had very quick fixes. So I'm a doctor of chiropractic. I'm also a dietitian with a board certification in nutrition, and I'm a sports nutritionist. I provide acupuncture, and I'm a life coach. I also have an MD diploma, although not a license to practice medicine. So let's get into this. To begin with, this information is for your educational purposes only. It's not meant as a substitute for sound medical or nutritional advice. So some causes are anemias. So most of you have heard of iron anemia, but that's just one anemia. There are more than 14 defined types of anemia. So one is iron anemia, as I just mentioned, and if you have that form of anemia, your iron may not be present in enough concentration to cause hemoglobin to be formed in your body, which is what carries oxygen to each tissue. So that'll obviously cause fatigue. And I wrote here that iron-rich foods like spinach or red meat would be a good source of dietary iron. And meat obviously is a much better source than green leafy vegetables like spinach. They contain non-heme iron, and meat contains heme iron. Heme iron is much more absorbable than non-heme iron. And then there's vitamin C. You can take vitamin C if you wanted to be a vegetarian to help your body convert the non-heme iron in plants like spinach to a more absorbable form, the heme iron form. Vitamin C will help with that. And then you might need iron, but you always want to know the cause or causes of iron anemia in a woman, which might be menstrually related or poor diet. And in a man, obviously he's not menstruating, so that could be ulcers, it could be hemorrhoids, for example, or even colon cancer. And then there's protein anemia, when someone is deficient in proteins. You need protein to make hemoglobin. That is a protein, actually. And the natural solutions for protein anemia would be eating high-quality proteins, eggs, fish, legumes, and or supplementing with proteins along with amino acids. And then also a very common cause of fatigue that usually is present for years before regular doctors pick up on it is hypothyroidism, or low thyroid function. So an underactive thyroid will obviously slow metabolism, leading to fatigue and even symptoms like brain fog. So in regular medicine, they will prescribe, if they've ruled out other causes of the hypothyroidism, physicians will prescribe medications like Synthroid. And I prefer to provide nutritional solutions first, and if they don't work, then sure, let's consider medications. So natural solutions, if a person is low in iodine, then that would be helpful for the thyroid, but not all people's low thyroid are from low iodine. So people will tend to take too much iodine, causing inflammation or thyroiditis, as it's called, which can actually cause fatigue, which is what you're trying to remedy. And then sometimes selenium or ashwagandha, the amino acid tyrosine. You know, the T3 and T4 are thyroid hormones. The T is tyrosine, so you must have tyrosine. You also must have iodine, because T3 is tyrosine with 3 iodines connected to it, and T4 would be tyrosine with 4 iodines. Your body takes T4, converts it to T3, free T3 is the active thyroid hormone. So already we know that iron anemia, hypothyroidism or nutritional issues, protein deficiencies can cause fatigue. What else might cause fatigue? Well, weak adrenals, B12 deficiency, or malabsorption. So weak adrenals might look like a lowered output of one of the major hormones from the adrenals, which gives us energy, called DHEA. So DHEA tends to tank, levels tend to go down at around age 30, and more people after that age have more fatigue. So it would be good to check the adrenal glands function and see if DHEA is the culprit there. And in medicine, I should tell you this: if you tell your doctor that your nutritionist or your chiropractor said that you have hypoadrenalism or weak adrenals, they're going to think of a condition called Addison's disease, and they should, which is why if you are a non-physician and you tell your patient that they have low adrenal function, educate them and tell them that this is different from Addison's disease, which is something that is a much more extreme manifestation of hypothyroidism. But if you believe that there is Addison's disease, any healthcare practitioner with a scope of practice to order blood tests could easily check that. And then I have many patients on DHEA for that reason. And then I could use adaptogenic herbs such as ashwagandha, ginseng, rhodiola, vitamin C, sleep. Now, what about B12 anemia? Well, a person could have malabsorption, not enough stomach acid, and that's 60% of people over age 50 do not have enough stomach acid. So you're not going to break apart the B12 from proteins in the diet, so you might end up B12 deficient, which can cause fatigue and neuropathy and other kinds of problems. We need B12 to form red blood cells, and we need it for neurologic function. So B12 is best obtained from animal products, and if you're adverse to animal products, that's fine. You want to get yourself a methylated form of B12. And then malabsorption, which is related to malnutrition, obviously poor nutritional absorption will cause a widespread number of nutritional deficiencies, which can result in fatigue. So B12 deficiency, protein deficiency, mineral deficiencies, B12 deficiency, just to name a few of them. And then sometimes the nutritional suggestions for malabsorption or malnutrition would be, of course, adjusting the diet appropriately, but giving the person digestive enzymes. I did another podcast called You Are Not What You Eat, You're What You Absorb, where I talk about enzymes in more detail. You should check that out. Also, probiotics and other nutrients which help to revitalize the intestinal tract, like the small intestine where most absorption takes place, like L-glutamine would be useful. And then what does pain, CVD, which is cardiovascular disease, and autoimmune issues have to do with fatigue? Well, persistent pain taxes the nervous system and disrupts rest. So natural solutions would be improving rest, obviously, by reducing pain and inflammation. Maybe an anti-inflammatory diet would be appropriate for that. But of course, what one person's anti-inflammatory foods may be another person's inflammatory foods. So that's something that has to be figured out specifically with each person. And then maybe trying turmeric as an anti-inflammatory, because chronic inflammation, whether it's from autoimmune problems or just normal aging, is fatiguing on the energy systems of the body. Sometimes physical therapy, acupuncture could help as well. But working on the causes of the chronic pain is essential, because again, chronic pain will affect sleep, it will affect wakefulness, brain fog issues, energetics. Now, as far as cardiovascular contributions to fatigue, if you have a weakened heart muscle and weakened delivery of oxygenated blood, you may feel very fatigued. Again, brain fog will show up there too, sluggish healing. So you obviously need your heart-healthy diet, and that might also include additional supplementation with magnesium and CoQ10, omega-3 fatty acids, L-carnitine, hawthorn berry, garlic, vitamin D3, and anticoagulant nattokinase if your condition involves a coagulation or thickness of blood, you might say, and resveratrol. So that's what cardiovascular system, that's how that can contribute to fatigue. And then there's autoimmune issues. Just think of autoimmune issues like a chronic degenerative condition, and that hyperutilizes nutrition, which can make you depleted in many nutrients, and that could cause fatigue. So that's really how chronic conditions of any type can cause fatigue. And then there is stress, sleep, and low blood sugar. So chronic stress is known to impair immunity. It promotes inflammation, brain fog, memory issues. And the natural solutions for stress would be to develop appropriate and effective coping mechanisms, reframing psychological events so you're interpreting them differently, getting better sleep, going to sleep at the same time, waking up at the same time, getting a minimum of 7 to 9 hours of sleep, and then taking care of your cardiovascular health and dealing with any weight gain, for example. So that's how chronic stress could lead to fatigue. And then in terms of sleep issues, that should be obvious, whether you have sleep apnea or just poor sleep, which could be from everything from eating too late before bed to too much electronics before bed and other stimulants. Some patients of mine, including myself, will have better sleep with rigorous exercise before bed. Other people, that ruins their sleep quality. So, you need to begin with proper sleep hygiene. As I mentioned, 7 to 9 hours of sleep, and then going to sleep at the same time, waking up at the same time, making sure that your room where you sleep is fully darkened before you go to sleep and that the temperature is comfortable, things of that nature. Maybe you'll need a CPAP if you do have sleep apnea. Sometimes magnesium, theanine, cannabinoids like THC can help sleep, and sometimes meditation could help. And as a last resort, sleep medications. And then hypoglycemia, low blood sugar. That's going to affect energy, obviously, because many of our tissues require glucose. So if we don't have that glucose, we're going to have issues with memory and crashing and focus. And natural solutions in that case would be to eat regular meals throughout the day, to avoid foods that have a adverse effect upon your blood sugar balance. There are high glycemic food charts on the internet. You certainly can consult those, but if you have one of these diets that needs improvement, you'll leave it up to your natural healthcare provider to determine which foods for you might be adverse from a glucose or a glycemic perspective and which are not, because again, people have very differing responses to these so-called these charts. So there are some fundamental tests that you should consider if you do have chronic fatigue. A complete blood count of CBC. Sometimes you might notice that you have an infection or you're anemic, so it'll show up there, or at least some of the anemia as well. And also the iron-bound protein ferritin, and then other tests of iron balance like iron and TIBC helps to evaluate to see if you have the proper iron status in your body. Vitamin B12 is very, very important. Deficiencies will cause fatigue. And then a comprehensive metabolic panel, which looks at the blood sugar, liver function, kidney function, very fundamental. And doing a thyroid panel, which should include, by the way, free T3 and reverse T3, and what are called thyroid peroxidase antibodies, and other tests of the immune system's effect upon the thyroid. So in other words, you want tests of autoimmune disease of the thyroid as well as all the basic tests. I find that doctors will pick and choose what tests they like, and they're not even consistent. Sometimes I've seen just free T3 measured, or other times a total T4 and TSH measured. You need to have all of these done. And then DHEA sulfate, that's the best test for the DHEA adrenal hormone. And also we can measure cortisol, because high levels of cortisol or chronically high normal levels can cause fatigue. Homocysteine and methylmalonic acid, or tests that tell us how well someone's using B6, B12, and folic acid, all of which are important for energy production. And then there's inflammatory tests, because chronic inflammation can cause fatigue. CRP and ESR are two such tests. Sometimes I might want to do an omega-3 fatty acid profile if I feel that omega-3s are underlyingly a part of the fatigue process. Sometimes sleep studies, a test for gluten intolerance, or a celiac panel, tests of blood sugar, including hemoglobin A1C, insulin, and glucose, and sometimes food allergy or sensitivity tests. And along with those tests, I'd be looking at the person's diet, a 7 to 10 day food log plan, probably do a body composition test to learn about their metabolic rate, and then based on a detailed conversation, I might choose to do all of those tests I just mentioned, or just some of them. And oftentimes I won't need any tests. The obvious is so clearly there once I speak with a client, that it's obviously a sleep problem, or their diet is just really bad, and they're not exercising, they're not taking any supplementation. So we might want to try to do certain things without spending money on tests if possible. So that'll about wrap it up for this brief presentation on fatigue, which was meant to let you know that there are many different types of fatigue. If you could just familiarize yourself with them, then throughout the course of your life, you will be a better healthcare consumer and healthier for it. Thank you so much, and I appreciate you, and I'll see you at the next podcast presentation.